When talking about tailbone pain, it is important to understand the anatomy behind it. In this picture, you can see there's a blue muscle highlighted going from the tailbone to the femur. When this muscle is too tight or weak, it can pull on that sacrum either which direction, causing extra tension in your pelvic region, thus causing a little bit of pain. In this next picture, as it scrolls down, you can see there's a little green ligament on the back end connecting from your sacrum to your sit bone. This is your sacrotuberous ligament, and when this gets tight or weak, you're going to see extra pull on the sacrum in the up and down motion, important when it comes to the Webster technique. One way we can start to release the tension in the tailbone, also known as your sacrum, so just know there are two different words for the same thing, is by sitting on your exercise ball and starting to find pelvic tilts. Isolating your pelvis, you're going to move forward and back. You can go side to side, make some figure eight circles. Not only is this incredible for prepping for labor and delivery, it is wonderful for starting to unlock the joint in itself. As you can see from the side angle, it's important to just use your pelvis rather than your entire spine. After unlocking the pelvic region, it's important to start to find length within the muscle. So using your exercise ball as a stability point, sink your hips back towards your heels. You're going to start to find a stretch in the glutes as well as some length and decompression into the sacral region. Moving the ball to the side will help you focus on one side versus the other. From the anatomy pictures you saw earlier, you will notice that the pelvis sits in a girdle form. So what happens on the back side is going to affect the front side, and what happens on the front side will then eventually affect the back side, which is why we love a hip flexor stretch. Bringing your knee that's closest to the wall in front of you and then using the wall for support, you're going to sink yourself back, dropping your pelvic floor towards the ground and looking over your shoulder, finding length in that hip flexor. The hip flexor comes from your lumbar spine, comes all the way through your pelvis and connects onto your femur. When the pelvis is misaligned or the tailbone is misaligned, we can find dysfunction, and where there's dysfunction, there typically ends up to be pain. Ensuring to find both sides regardless of which side the tailbone pain is on. Another fantastic way to stretch the hip flexor is by coming into a Z-Sit. By coming into the Z-Sit and leaning forward, you're decompressing through the sacrum, and by leaning back, you're opening up that hip flexor, balancing out the pain in the back and the tightness in the front. As you swing to the other side, you're also adding a little bit of hip mobility, which can aid in unlocking the pelvis. Now that we've stretched out the front side, we can move on to stretching the back side. So using the wall as a support for your back, bringing yourself into a figure four position, placing your ankle over your thigh, not your knee. You're going to hug your knee in towards your chest. By hugging your knee in towards your chest, we're stretching out the piriformis, which, if you can recall, was the very first anatomy picture that we showed in this video. It connects directly from that sacrum or your tailbone to your femur and can contribute a lot to not only tailbone pain, but other common pelvic girdle dysfunction. By dropping that leg over, we were just adding an extra little stretch. On this side, you can see that hug that knee in, adding that look over the shoulder can also aid in finding a little bit deeper of a stretch. For all my ladies saying there's no way I am getting on a floor to do that stretch, don't worry, we have a seated option for you. You're still going to bring your ankle across your thigh, you're still going to hug your knee in towards your chest, but rather than using the back of your chair as a support, you're going to think about arching away from that back, lifting yourself up nice and high, looking over your shoulder, creating that extra little stretch. To support yourself throughout the day, repurpose your Boppy for when you sit on a chair. As you sit down, it's going to provide a little bit more space between your tailbone and the chair, giving you extra cushion and more comfort. Grab a tennis ball. We are going to release the sacrotuberous ligament. As you can recall from the second anatomy photo, it connects from your tailbone to your sits bone. So this discomfort may feel like discomfort when sitting, not being able to find a comfortable position, or at times feeling like your leg might just give out, as the tailbone sits in between the two pelvi that control your ability to go forward and back, side to side, and all the fun things our legs love to do. To release this, you're going to sit right on the midline, right off that tailbone, and start to move your leg out and move your leg in to release the tailbone pressure. And while we need all of the length and all the stretching, it is also important to find the activation. The muscles just need to reawaken sometimes. So, coming into a squat, you're going to start to press your knees out and in using your pelvic muscles, your glute muscles, your piriformis, and your deeper pelvic muscles, ones you probably didn't even know you had, to move those knees out and in. To get even more of an activation, you can do a doorway squat. So, coming into a stance, find a sturdy door, emphasis on the sturdy, squat yourself down. At the bottom, turn your glutes back on and lift yourself up high. If you don't feel quite stable enough with the door, go ahead and find a chair, squat yourself down, squeeze those glutes, and squat yourself back up to use those glute muscles once again. And if you're wondering why we need the stretch and the activation, it's because at times there are really tight muscles that are truly just tight. And so we need to release those in order to release tension elsewhere in the body. But oftentimes there can also be weakness. And when there's weakness, there's compensation elsewhere that can cause even more discomfort than the original pain point.